Hello, I am Dr. Gauri Gore from Mumbai. In my last video, we spoke about how to plan for a pregnancy, and today I'm going to discuss with you the investigations that are required during the pregnancy. Pregnancy is a journey of 9 months and it's an evolving situation with development of the baby. So the investigations which are required throughout pregnancy depend on the stage of the pregnancy and the condition of the baby and the mother. Some of the investigations are required for all the ladies who are pregnant, and few of them would be in specific situations. So this is a chart which depicts the investigations which will be done for all the pregnant ladies in various stages of pregnancy. Today in this particular video, I'm going to discuss about the investigations which we will be doing in the first 3 months of pregnancy. Before I start, I have to tell you that pregnancy is divided into 3 trimesters. The first one is up to 13 weeks, which is roughly 3 months. The second trimester is from 4th to 7th month, which is up to 28 weeks. And the third trimester is from 29 to 40 weeks, or the time of delivery. Now, the first and foremost investigation is to diagnose pregnancy. Whenever a woman misses a period, she skips her cycle date, the first thing which we need to find out is whether she is pregnant. And there are a couple of tests. Most common done is a urine test. I'm sure a lot of you must be knowing about a urine pregnancy test, which is a home-based test. There are kits or cards available which a lady can perform on her own, and she can find out if she is pregnant or not. The urine pregnancy test is very much sensitive, but in early stages of pregnancy, at times the urine test can be negative in spite of pregnancy. And hence, to confirm the pregnancy at this particular point, we might have to do a blood test that is called as a serum beta HCG level. This blood test measures the level of the hormone which starts rising once the fertilization has taken place. And if the test shows the beta HCG levels are on the higher side, we can diagnose that a particular lady is pregnant. Once we know that there is pregnancy, then a lot of blood tests would be advised to find out the health condition of the mother, where we would want to find out her complete blood count, to find out hemoglobin levels, the platelet counts, the thyroid profile, blood sugar levels, some of the viral markers to figure out if she has infection with any of the viruses, namely HIV, HBsAg and HCV, which can have impact on the baby. So these are the tests which are routinely done. We also will do tests to find out the blood group of the mother if it is not known already. And then a couple of times we might have to do tests to find out the kidney and liver function. So these tests are not recommended for all ladies, but many times if there are any high risk factors, these tests might be required. We also would be doing HB electrophoresis test in case it is not done as a part of pre-pregnancy checkup. This is about the blood test. The second important investigation which is done throughout pregnancy at various stages is ultrasonography. Ultrasonography has revolutionized the management of pregnant mothers, and it has got a lot of positive impact in preventing maternal and, more importantly, fetal complications. In the early stages of pregnancy, ultrasonography is done, 1, to diagnose the pregnancy, number 2, to find out if the pregnancy is at a normal location. Why do I say that we have to find out if the pregnancy is at a normal location? The normal location for any pregnancy to grow is in the uterus, but the fertilization always takes place in the fallopian tubes, and the fertilized egg then travels through the fallopian tubes and gets implanted in the uterus. However, in some cases, the fertilized egg or the embryo doesn't grow in the uterus, but it gets implanted at abnormal sites like fallopian tubes, ovaries, or any structure in the abdominal cavity. that is called as ectopic pregnancy, and this is an abnormal pregnancy. In case the ectopic pregnancy is not diagnosed, there are severe maternal complications with lot of bleeding inside the abdomen. Hence, the early sonography is going to confirm that the pregnancy is in the uterus and not in any abnormal location. The second aspect of early sonography is to see if the pregnancy is growing, or what we call as a viability scan. What a viability means is it is not enough for us to find out that there is pregnancy in the uterus, but we also have to see if the heartbeats can be seen. Even at the earliest stage of 1.5 to 2 months, we can see the heartbeats, which ensures that the pregnancy is alive and will grow. I'm sure you must have come across situations where pregnancy was diagnosed, but after few weeks, it landed up in miscarriages. The most common cause of early miscarriages is what we call as non-viable pregnancy, where the fertilization happens, the embryo is formed, but because of certain reasons, the embryo doesn't grow, and hence on sonography, we do not see heartbeats. So these are the reasons why an early sonography is very important. There is a common doubt that whether a sonography has to be done externally or internally. What it means is whether the sonography has to be a transabdominal sonography or internal is transvaginal sonography. There is a lot of misconception that doing a transvaginal sonography is not good for the baby or it causes bleeding. That is not true. How to do a sonography, whether it is only external or transabdominal, or we have to do a transvaginal or internal sonography, is a decision of the doctor who is performing the ultrasound. If the doctor feels that some of the details are not seen properly from abdominal sonography, then a transvaginal sonography is a must for proper diagnosis. Also, in certain pregnancy situations, a transvaginal sonography will give us the correct measurements which a transabdominal sonography may not be able to provide. Hence, leave this decision to the doctors and be assured that doing a transvaginal sonography is not going to harm the baby in any manner. Towards the end of the first trimester, around 12 to 13 weeks, another set of tests is very important. This is a pair of sonography and a blood test. The sonography, which is called as NT scan, is important to find out early fetal abnormalities. Also, it is important to find out the blood flow pattern in the uterus. In case there is any abnormality in the parameters of the blood flow in the uterus, there are higher chances of development of high blood pressure or low birth weight babies in the later stages, and hence some corrective measures can be taken. Some medicines can be prescribed to minimize the possibility of this situation arising after 6-7 months of pregnancy. A blood test which is combined with the sonography is called as a dual marker test. This is a screening test to find out if the current pregnancy is at a high risk of having chromosomal abnormality, most commonly Down syndrome, trisomy 13 and trisomy 18. So we do a combined test of ultrasound and a dual marker test for all ladies, and a statistical analysis is made into screen negative or screen positive. Screen negative or low risk report means the risk of having a chromosomal abnormality is same as it is for the average population, matched by the parameters. A high risk or a screen positive test means there are higher chances of having chromosomal abnormalities in this particular pregnancy, and hence additional advanced investigations would be necessary to diagnose if actually the developing baby is suffering from any chromosomal abnormality. The advanced test which could be done to find out about chromosomal abnormalities are of two types. A newly available test that's called as NIPT or non-invasive prenatal testing is also a blood test which is extremely sensitive and it can diagnose chromosomal abnormalities in more than 99% of the cases. So a NIPT test might be done if dual marker test is abnormal or if the mother's age is on the higher side. Instead of doing dual marker, we might do NIPT. One thing needs to be remembered, the NIPT test is by maternal blood, but at the end of the day, this is also a screening test. However, the sensitivity and the specificity of the test is very, very high. The confirmatory test to find out what is the genetic pattern, what is the karyotype of the developing fetus, is by doing amniocentesis. Now, amniocentesis is an invasive test and it is done usually after first trimester, after 13 weeks. I'll discuss about amniocentesis in some of my next videos. So this was all about the investigations that would be done in the first 3 months of pregnancy. In my next video, I'll talk about what investigations would be done in the second trimester. See you then. Bye.